great opportunity to speak with everyone about something I'm really passionate about. It's Chinese medicine and healing with Qigong. So I want to talk a little bit about myself first. My name is Snohomish Brown. I've been a student of Chinese medicine for over 4 years. I've been a licensed acupuncturist for the last 3 years. So the thing I want to talk mainly about is Qigong and what Qigong can do to help with healing the body. The body is able to heal itself primarily, and this is one of the things that a lot of people probably don't really recognize, and they think that they need to get a pill or something to help them. But in actuality, the Chinese have known this for a long time, that there are systems in the body that work well together, and if things are flowing naturally and there's no stagnations, then you can prevent most illnesses from taking root in the body. What I want to share with you today has something to do with these systems, and I want to tell you about how these systems connect and how the energy flows through the body and how these systems relate to one another. I'm going to show you guys an exercise. So I know that there's not a whole lot of people in here right now to experience this, but if you guys can come in, and if you guys are waiting outside, the exercise I want to show you requires you all to stand up. So this might be a little tricky. Let me figure out how to do this. Okay, so I'm going to demonstrate a movement exercise. Perfect. Thank you very much. So So I have a slide here showing the midline and a few of the other meridians on the body. What these meridians do is they flow qi, and we'll talk about what that means in a second. And the qi flows in certain directions through here. So what we're going to do is assist that qi flow by dredging the channels with the exercise that we will just call tapping for now. So we'll start with tapping at the lower point of the model here on our bodies. That'd be the midline. This midline we call the Ren channel. We can also call it the conception vessel, and it governs a lot of our sexual organs, our ability to conceive, for instance, in particular the uterus and the testes. So what we're trying to do here is to release any stagnation along that line. So we'll gently tap as we move along the midline, coming up towards the chest. We're going to open up one of the arms out to the sky, palm up, and begin tapping underneath the armpit. And then down the medial part of the arm, where there are 3 channels, as you can see in the photo here. So we'll come all the way down to the fingertips, turn the hand over, and you can see there's also 3 lines that go along the outside of the arm. So I want to use this slide to illustrate some differences between what we can call yin and yang. The yang is on the outside, and the yin is on the inside. So this is one of the ways that yin and yang work or are contrasted with one another. So we want to bring that tapping all the way up over the shoulder to the back. We want to try and access the midline on the back, which is the Du channel. And this channel governs all of the yang channels. So we have a yin channel that governs all the yin channels, and we have a yang channel that governs all the yang channels. And then we have 3 channels on each of the arms, on the inside and the outside. Yin going in this direction, and yang going in this direction. And this dredging of the channels helps to open up that. You might feel a slight tingling. So we'll start with the other side. So beginning again at the midline and coming up along up to the chest. We'll tap underneath the armpit again. And then the medial side of the arm as we come down towards the fingertips. And then turn the hand over as we come up along the outside of the arm. You might feel a lot of stagnation there. It might be a little tender. Then you can rotate back and forth along the arm to get all 3 channels. And then coming up along the back here. A few sensations that you might feel from doing this exercise as we pull the energy down. There's a little bit of tingling, maybe some movement, a sensation of slight movement, or maybe some warmth even. This is a good sensation. We want to take that sensation and bring it to the back where our kidneys are. And do some slight rubbing here as I change the slide. So the foot yang channels are 3, and they are on the outside of the back, along the sides, and along the front. And we'll come to that later. For now, let's start with the tapping along the back. So as we're tapping along the back, we bend forward. Bring the tapping along the sides, and be careful around the knee. Bring it all the way down to the feet. And then coming back up, we're going to tap along the inside of the medial part of the leg, up to the top of the hips, the ASIS, the anterior superior iliac spine right here of the hips. We're going to tap right below that. It shows you right here, this point right here, right below the hip. And this will help to connect the lower body with the upper body. So we can bend a little bit there. You should feel really good right now. Anybody that's been participating with this, how many people here feel a noticeable difference in their bodies right now? Good. Yeah, good. Okay, good. So this is one of the things that I wanted to illustrate with this Qigong exercise, is how these meridians work, and give you guys a practical demonstration of how Qi flow works in the body. Now we're going to talk a little bit about how Chinese medicine works. So go ahead and have a seat. So one of the things I want to illustrate to you guys is how these systems relate to one another. We talked briefly about the difference between yin and yang. Yin being the external, opposite. Yin being the internal, yang being the external. But we can also see yin and yang as opposites of like hot and cold, and also excess and deficiency. And these are very important. We'll get to these later. But one of the things I want to illustrate with this slide is how all of the yang channels, and as you can see, there's really only 3, but they have been split into hand and foot. So we have the Tai Yang, the Xiao Yang, and the Yang Ming. They've been split into 2, each of these, one for the hand and one for the foot. And they correspond to different organs, which I'm sure you're familiar with. The key thing to understand about each of these organs is that they all fill and empty as part of their normal function. If they don't fill and empty, then we say that they are malfunctioning. And there's a big problem with that, usually. Okay, so normal functioning is that they fill and empty. And they do that on a regular basis. If they do that too frequently, then there's a problem. If they do that not frequently enough, then there's a problem. So the idea here is to keep things flowing naturally so that they cycle comfortably and that there's not a problem with that. Next slide. In contrast to that, the Zong organs, they store vitality. They do not fill and empty. They continually store. Once they have been exhausted completely, then there is a big problem. And that's when we reach the end of our life, is when there's that big of a problem that their vitality is no longer able to be stored in these organs. So the key thing for longevity is to make sure that these organs have as long of a lifespan as possible. And oftentimes, if they're not in harmony with one another, there'll be a problem with that. So we want to make sure that all of these organs are in harmony with one another, and this is why, again, we stress the key to health is keeping these things free from stagnation, keeping the flow, energy free. So when we do Qigong exercises, we break up the stasis and the stagnation, and in this way we can ensure longevity. If we keep our practice regular and do it every day, essentially this can lead to a very long life. This is why Tai Chi and Qigong is so important, and why there's so much value placed upon it in Eastern cultures. So here again we look at the 3 channels that store vitality, the Tai Yin, the Xiao Yin, and the Zhui Yin. So it's very important to see these relationships because you can understand how some of these organs will work against each other. And in order to bring healthy balance, we want to address how they're working against each other and address that in a way that creates more cooperation and harmony between these organs. So, for instance, it's not shown here, but the liver organ and the spleen organ, or spleen pancreas, which governs digestion, they sometimes can operate in opposition to one another. And so a lot of times when people are experiencing health issues, we will address these 2 organs in particular to treat in Chinese medicine. This is a very famous formula. Some of you may have heard before, rambling powder, maybe. Anyway, I want to move on to the next slide. So we're going to talk about models of health and disease from a Western perspective and compare that with the Eastern model. So a lot of times people will wait to go to the doctor until there's something wrong with them. And in the Eastern model, a lot of times that's a little bit too late. So we want to focus on how the Eastern model really works on preventive medicine. Western model, they really focus on, okay, if it's broken, let's go fix it. So they focus on pain and functionality. When things are not functioning right, or when you're in a lot of pain, for instance, that's when you go to see the Western doctor. From the Eastern perspective, you might go see a doctor just for a regular checkup, and this person can help prevent you from getting sick before it happens. So the idea here is to keep that in check through flow and harmony, as we just discussed with the Qigong exercise. In the Western model, let's move on. We can talk about rigorous testing that they do in order to make sure that everything is working functionally. There was a really interesting talk that was just here a few minutes ago where we talked about how the technology that we have is allowing us to make those kinds of tests on our own now. And this is really fantastic. I think that the Western models of rigorous testing are great. However, a key thing to keep in mind is that testing just leads to more testing. And often that can be expensive. So we want to make sure that when we're testing, that we're actually testing for a good reason and not just because we can. This might lead to a lot of false positives also with rigorous testing. A lot of times people will be diagnosed with something that they don't really have. And that's possibly because of a false positive on a test that they were given. So testing is also done often as a means to rule out certain illnesses. And do you need to do that with all illnesses if you really know what the cause is? Probably not. So there's some strategies involved with testing that one should consider before just getting tested on everything. So the Chinese look, listen, and feel as part of their diagnostic model. They use a very rigorous testing as well, but it's in more of looking at the patient, looking at the color of the phlegm, for instance, looking at the facial features, and also looking at the color of the face. Colors are very important in Chinese medicine as far as diagnostics, and that's one of the things I think Western overlooks completely, is the color of the phlegm, for instance, or the color of a person's face. Sometimes it's very important in Western diagnosis, but only in severe cases where cyanosis could occur when they're looking at the blueness of the lips, for instance. That's very important in Chinese medicine too, but I think that Western diagnosis could do a little bit better on incorporating some of the diagnostic models that the Chinese use. And so for that matter, I want to point out that the Chinese have a 10 asking song, which is part of the diagnostics, where they ask you about 10 different questions, 10 different categories. They ask you if you are experiencing chills and fever. They ask you if you have any funny tastes. They ask you about your appetite, your thirst, your bowel movements, your urine. Certain things that you would probably expect to see in a standard checkup, but in this case, the diagnostics are used almost every time to really look closely at how these different systems, well, on the previous slide, work together and how they're not working together, perhaps. So palpation is also a very big part of that, and that's where the feeling comes in. Also in Western models, they use palpation too, but how often do we hear about how doctors only spend maybe 15 or 5 minutes with their patients and don't even touch their patients or even look at them? So this is a big problem, I think, in Western models of health, but it's not necessarily a problem with the model itself. It's just how it's being used and incorporated in our society today. And I think that the Eastern model, especially in practice today, with acupuncturists that I know of, they spend a lot more time with their patients and really get to know what's going on with them a little bit better, I believe. And that's because of the approach that they use and the models that they have for that. The Western model is a very based on analytic approach, and they're very good at that. The analyses that we can do with the Western models and the technologies that we have are unparalleled. And we can really find out what's going on even at the cellular and the atomic level now. So this is really amazing that we can do that. On the other hand, the Eastern approach is more of a synthetic approach. We try to look at the whole picture rather than just the tiny little parts. And we use that to come to a complete understanding, realizing that in most cases, proper diagnosis is 80% patient history. So if we understand the patient history, we can give the more accurate diagnosis. And that's why the synthetic approach really works. So what I mean also by the synthetic approach is that we're looking at the whole system. We're looking at all the systems and how the systems work together. We're not just looking at one organ. We're not just looking at one body part. And this is really the superior method, because the body acts as a whole. And we understand also that the myofascia, which a lot of people might not be aware of, and how the tissues that surround each of the muscles, called the myofascia, which is mainly a base of fats, of tissues that run like spindle fibers through the body. These things act as a web that surrounds the body. And just like a spider's web, when you touch it at any point, it affects the entire system because it's under tension. And because it's under tension, the body is able to communicate with itself when you put a needle in a distal point, far from where the site of injury occurred, and it can affect the site of injury. So I think that this is one of the things that people are trying to understand more about, but it may be that it doesn't really matter, because if it works, why try to fix it? But I think it's important to know also, because when we look at studies that describe sham treatment in comparison to real acupuncture, when you're trying to understand whether or not acupuncture works, for instance, I think it's unfortunate, because if you don't understand how acupuncture works, if you don't understand the mode of operation, and you're trying to create a sham treatment, it's intuitively obvious that you're not going to be able to succeed, because you don't know how it works. So a sham treatment doesn't make any sense. You don't know what the placebo is if you don't understand what's making it work in the first place. What people should really be asking is, why is a sham treatment almost as good as, but not quite good as, real acupuncture? I think that's a more interesting question than asking simply, well, does it work? It's like saying, well, does pharmacology work? I think it does. So in other words, why would they be doing it for so many years? And anyway, we'll get on with invasive solution with drugs or surgery. I think this is pretty much obvious, that we believe from a Western point of view that the body can't heal itself. And so we need to invade it with drugs and surgery. Whereas in the Eastern model, we really try to assist the body to heal on its own through the use of herbs and acupuncture and other models or other treatments. In the Western model, we want to interfere or intervene where the body cannot no longer function. And in the Eastern model, we were going to use preventative medicine designed to prolong the function. So we touched a little bit about this earlier. We'll sort of just breeze right through it. The diagnosis by 8 principles. This is a really quick and easy way for us to diagnose in Chinese medicine. However, it's just a starting point. We also want to look at 6 stages of cold disease, which progressively penetrate through those 6 channels, like I was describing earlier. And as they progress, we get a different symptomatic picture. We also look at ways that heat can penetrate the body. And so we have a diagnosis by 4 stages of heat. We look at those where the heat has penetrated based upon the diagnostic picture at each of those 4 stages. So we can also look at the diagnosis by 3 burners. When I showed the slide earlier, it showed a few organs you probably weren't familiar with. The triple burner is one that governs dampness in the body. And when we have too much dampness, it's not able to move correctly, and it can cause problems, especially with the bowel movements. So we see a lot of people that generate dampness and heat together. This can be really difficult to get rid of. And this is a combination of deficiency and excess, usually. So when we're dealing with internal medicine, we're really focused on those 5 Zong organs. And when we're dealing with the exterior, we're talking about cuts and sprains and things like that, which can usually be much easier to heal. An overall picture, if we look at the cold, deficiency, and interior as yin, and we look at the hot and the excess and exterior as yang, we can identify a disease as being primarily yin or yang or a mixture of the two. And this is really useful to know. It can help guide which herbs to use, and it can also tell us which channels we want to focus on and which points on those channels to use. So just to sum up, I want to point out a few treatment modalities that we use in traditional Chinese medicine. That's what TCM stands for. Qigong and Tai Chi, as we talked about when we demonstrated earlier. I hope you guys enjoyed that exercise. Tui Na is also a modality that we use. It's similar to medical massage. We can use that for a lot of different illnesses, which involve the channels. So whenever there's stagnation in the channels and the tapping doesn't do it for you, we can use a little bit more vigorous treatment to open up and break up the stagnation. This can be useful for relieving pain. This can also be really useful for helping more of those internal organs and their harmony together. Gua Sha is a technique which some of you guys might be familiar with. If you're not, I will explain it. It's scraping, essentially. The scraping is done along the skin to raise the blood to the surface. And when that blood is raised to the surface, it's extravasallated from the capillary system into the extra space in between the cells, and then it's able to be drawn back in. And this kind of therapy is actually they're trying to reproduce this therapy in Germany. I think they're calling it Eigenblood. I'm not exactly sure what the name is, but it's very popular in any case. And the reason is because this actually helps to restore the health of the interior organs. And so Gua Sha is a very useful technique for that. We don't even have to pull the blood out of the body. We can just keep it in there and use this technique and have very similar effects. I recommend doing more research on that if you guys are interested in it. It's very extremely exciting to understand the benefits of Gua Sha, and I think that your efforts will be well rewarded. And of course, most acupuncturists are very familiar with this technique and can help you with enjoying the benefits of it too. It's also very folky medicine, so a lot of people do it at home. They can use a spoon or a coin. It's very common in Eastern cultures for them to do that. Just a little bit of oil to keep the skin from abrading. Finally, cupping is very similar to Gua Sha. We use a cup with suction on it to pull the skin away from the body, to also pull the stagnant blood that's in the cells or in between the cells, to pull it into the lymphatics to get it flushed out. So this is also very good for relieving qi stagnation. This qi stagnation is really common. A lot of people feel sore, tired muscles in the shoulders, neck, and back. This is very common, and this kind of treatment can be very useful for relieving that. So I highly recommend it for anyone, because everyone feels that sort of sore neck, stiff, back and all that. Moxibustion is something you probably have not ever heard of before, but it involves burning an herb, which can create a warm sensation on the body when applied. We usually hold it about an inch or so above the skin. Certain points on the body respond very well to this. Of course, you don't want to use it next to the head because of the smoke. It can irritate the eyes and nose and all that. But using it along the belly can be very good for improving the digestion. And in fact, there's a point that we started when we did our tapping exercise. This point in particular is very good because it can be used with moxibustion to strengthen the qi, the blood, the yin, and the yang. It's a very useful point, to the point that many people use it every day, and maybe even you might notice some really powerful qigong masters might have a burn scar there. So it is a very important point, and I think that moxibustion is something that's underutilized, mostly because we live in a very warm climate. It was very popular in colder climates to keep people from catching a cold or for getting sick due to cold damage. Acupuncture and electroacupuncture, many people might not be aware that you can attach needles or attach electro stimulation to the needles and provide you even greater benefit from the needles alone. It's very similar to when somebody who is very proficient in Qigong utilizes the needle and is able to move the qi in your body, similar to Tui Na or massage, but with the needle. Yes, question? 1 minute? Okay, we're almost done. The last point I want to make is just how nutrition is very basic to Chinese medicine and healing, as well as herbal formulas as another adjunct therapy that we can use when you're not able to be present in my office. We can heal you from afar with the use of Chinese medicine and herbal formulas in particular. So does anyone have any questions for me at this point? There's a lot of information, so I just kind of unloaded on you guys. Hi. Well, okay, so certain journals have well, scam as opposed to sham, because I mean the definition of sham, they use it to identify whether or not acupuncture works or not. They use not real needles, but like those fake dagger needles. You know, like have you ever been? You know, you've seen like a fake dagger? You like stab somebody and it's spring loaded. So they have a similar kind of thing with they created out of needles, where it's not a real needle. It just looks like it goes into you, but it doesn't actually penetrate your skin. So but that's completely different than I think what you're talking about. How do you know if a practitioner is good or not? I think is the question that you're asking. If they ask you a lot of questions, if they're able to communicate with you and you feel that they get what you're talking to them about, and if they ask you questions that you think are kind of strange, they really care about wanting to know about what's going on with you. If you get that feeling that they care about you and want to know what's going on with you, I would trust that person. You're welcome. Anybody else?
In our Western model, we're learning that a lot of the stuff the doctors are doing still isn't evidence-based. There's a lot of just
That's true.
misunderstanding. Old modalities have a hard time dying. And, is anyone doing the same thing on the Eastern medicine side, trying to improve it with collecting evidence and trying to show that with double-blind studies and so forth that something is actually better one way than another?
I'm really glad you asked that question. There are. It's really difficult because the FDA doesn't want to approve any of the studies because of all the paperwork involved. Because we have over 300 different herbs that we use, and they all come from different sources. So in order to get the studies approved, they have to be, all of the materials that are going to be used in the study have to be approved by the FDA. So this is a very difficult process, but there's a group of researchers in Portland, Oregon, who are making some great headway in that, and they were able to get some herbal studies done that were approved by the FDA. So this is a good sign, a good step in the right direction. So I think that the evidence base is a key question here, and I think that it's important because a lot of people use that as a standard. But I think what would really be helpful is comparative study designs, which would show like how does a shoulder injury treated by a Western model compare to a shoulder injury treated by an Eastern model, and maybe even how does a shoulder injury compare when treated by both models. So I think this is a very much better idea of how to show whether or not evidence-based is really a key factor or not. So thank you for asking. Did that answer your question? Good. Good. Any other question?
Thank you for interesting presentation. I learned a lot. What do you think of a physical therapy? It seems like it has an element of a little bit of a Western medicine. And I know from my point of view, it seems like it's more on the Western side, but I seem to incorporate some of the things that you talked about.
So usually if you get an injury, an orthopedic doctor will send you to a physical therapist in order to get similar treatment to what I would call medical massage. Okay, so anytime you get a what I would call a chi meridian stagnation kind of issue, where it's in the external part of the body, these kinds of symptoms can be treated by all of these treatment modalities that I just discussed, as well as, if not better than, physical therapists. In fact, in many states, there is a battle, very heated battle going on between physical therapists who believe that dry needling is not acupuncture and can use that without going to school to treat people with a needle, and they're injuring people with pneumothoraxes very often because of the aggressive techniques that they're using and the poor training involved in giving them certification to do that. And this is a very heated debate all over the country. In fact, in the state of California, you can no longer buy acupuncture needles unless you can prove that you're an acupuncturist. So this is a huge deal. And doctors and physical therapists are trying very difficultly or hard because they realize the value in Chinese medicine to take on those into their own practices and bring that into their scope of practice, excluding acupuncturists from even entering the hospital. Okay, so this is a very big issue. And I would hope that people would realize this and would go to the people that have 3,000 or more, 4,000 hours sometimes, of training and using the needles before they would go to a physical therapist who maybe only has a weekend course. Any other questions? Okay, good. Thank you guys for having me. Appreciate it.
Thank you so much.